Good morning. This is Dr. Nardone. It is Thursday, the 2nd of April, and it's Dr. Nardone with real information from a real physician. I told you I'd be back, and today our three thoughts of the day are as follows. Number one, there seems to be a lot of confusion around wearing masks or protecting your own personal nose, nares, mouth. And there is some misinformation in there on TV, even news media, and they're telling people that if you're sick, you should use a mask so you don't get other people sick. I want to clarify that statement. That's a misnomer. If you're sick or you have symptoms and you feel off, you should not be out in public. You should be home. You should be quarantined. The only reason why you should be out if you feel sick or have any suggestion that you have coronavirus is to see your doctor, is to be tested, or if you're going to the hospital. Otherwise, if you feel sick, you have no business being out. The purpose of the mask is to prevent transmission of the 25% of people that may be harboring the coronavirus and are asymptomatic. A meaning not, and symptomatic meaning symptoms. They do not have symptoms, or as we're finding now, they may be pre-symptomatic, meaning they haven't manifested the symptoms yet, but they have the virus. And there's some thought out there that if you protect your mouth and nares, if you do sneeze or cough, you're not going to project those particles and those droplets to other people around you. Make it clear, though, that it is not a panacea for protection for you, because those masks are not going to protect incoming viral particles from other people or things you touch or in the ambient of air, etc. So just make it clear that there's no good data that proves it helps, but it may be a reassurance that it helps. And that's why healthcare workers are using them in hospitals in case they themselves have the virus and are unaware. So please be aware that you are, use your judgment here, but if you are sick, you should not be out there. This is not to prevent an ill person getting someone else ill. If you're ill, you should not be out in public. Number one. Number two, I do want to mention that we all are hearing about the symptoms: fever, chills, severe chest pain, shortness of breath. But I also want to address some of these symptoms that are less common, but certainly problematic and certainly out there. And I want you to understand that not everyone's been talking about them. These are people that are talking about severe headache, severe onset of a very crushing headache. There's also people losing their sense of taste, their sense of smell, that's called olfaction, and other things that may come on are night sweats. Some people are feeling very listless. You hear the word fatigue. The word fatigue just means that you feel low energy. If you're finding yourself unable to stay awake during the day or not being able to function, that's fatigue, if you easily are worn out. So please be aware that if you're having such symptoms as these are also symptoms of coronavirus, and assume that that's what it is, and talk to your healthcare provider. Telehealth is rampant in the medical community today, and you should be able to get an appointment with your via telehealth with your primary care. And the last and not least, I do want to say that your own immune system is so important to keep intact at this very, very, if you say, vulnerable time. You have to understand that you may be home now with all this time on your hands, and it's not time for you to sit on the couch, get sloppy, get lazy, and get fat. It's a time that you never had before, where you used to use the excuse, I don't have time to work out, I'm working. I'm getting fat because I'm sitting at my desk in front of a computer all day. That is not the case right now. If you have this freedom, if you will, of your schedule, you should get up every day, get a schedule, get up, make your bed, get a schedule that you're going to work out. There's many videos out there. Many gyms are putting videos where you can stay in fit and do something aerobic every day. You don't have to go purchase expensive equipment. You have to take it upon yourself to have this discipline. The other thing is make sure you're not just wondering where you're going to eat out your other meal, takeout. This is an opportunity to cook at home, get healthy food. The grocery stores are still open. Get healthy food, cook at home, get your antioxidants, get your bright leafy vegetables and fruits. This is an opportunity to learn how to eat healthy. Keep yourself as healthy as you can. Get your vitamin D. If you're not, take vitamin D supplements. I do urge you that if you have an intact and robust immune system, you will be better to combat this virus if you should get it. You will be better equipped to recover quickly, just like you would train for an athletic event, just like you would train for if you had to do a presentation at work, you would prepare, just as if you would prepare for a test, or if you were preparing for childbirth, anything, you would get your body ready for that. Well, you have an opportunity now to do that and take it upon yourself to make this a resolution for yourself. It is going to be a long month if you don't take control of healthy aspects of your life. And as always, I leave you with my favorite expression of the day. Make sure you keep your faith stronger than your fears. Goodbye.